Hey everybody, it's Lahoma. Sorry it took me so long to finally make a little video of how I applied for disability and what I think helped me get approved the first time around. I did a little research first, and one of the things I remember someone saying was that you should put down every um, disorder, diagnosis, symptom that you've ever had, any doctor that you've ever seen, because even though it might seem insignificant, if you've got a bunch of little conditions, they can add up and add to the disability. So I put down a lot, but I started off, I filled it out online, and I actually didn't submit it right away, and they actually sent me a denial letter, and I'm like, wait a minute, I didn't even actually finish my application. And they're like, oh well, it timed out, you didn't submit your medical information in enough time. And I was like, well, I was trying to gather that information. So I called them, and they just restarted it. I didn't have to, it wasn't an actual denial because they didn't have any medical information. So make sure that you do meet all the timelines, but if you run into any problems, just call them. So I fill out the first part of the disability application online. I think this is my printed out copy. Basically, I listed, it only allowed you to list 10 conditions, I think, or I hit more than 10, but when it prints out, it only prints out 10. So I started with the most disabling and then kind of went down from there. Um, Then you had to list all your doctors, so and what they see you for and the medical conditions treated. So I listed everything and everything um, the treatments that I have received for them. So I wrote as much as possible, but trying to be as concise as possible. But I think putting, every little bit of information. So I put all my specialists, my neurologist, my cardiologist, my immunologist, a GI doctor, endocrinologist, um, OB-GYN, family doctor. I had went to Mayo Clinic already, so I put them down. I put down my therapist. I'd seen Dr. Trevino at that point too, so I put him down. I had, and then they asked for hospitalization, so then I put that down, where I had had surgery and been in the hospital last summer. And then all your tests you have to put in. So I put down like every little thing I could think of, even blood tests, vaccine challenge that I had to diagnose my antibody or my immune deficiency. I did even my allergy skin testing, just so that they can see that you've been going to the doctors, you've been seeking treatment. Every CT and MRI I've had, all the blood tests that I had run. So some of them were repetitive, but I put everything down. Um, and I went back as far as I could. I actually requested all my medical records from NCH. I had been an employee there, so I had been to in the ER several times there before with UTI infections and kidney stones before I got my immune deficiency diagnosis and sinus infections. So it kind of helped to get all of my records because a lot of it was through employee health when I was an employee there. So I had forgot about all those visits because they weren't actually an ER or a doctor. Then they want all your medications, who prescribed them, what they were prescribed for. So again, just try to be as thorough as you can. And then the work activity, I put when I stopped working, which I wasn't even sure what to put there because I had tried working after I had really quit working. But then it also asked the dates that you started changing to your work. And I put all the way back in 2013 because that's when I had to first begin modifying my work. And then it gives you a space for remarks. So I kind of put in there how I had changed my work history since 2013. The one thing I think I messed up on a little bit is I kind of gave them a date of February 2019 that was the last date I taught yoga. Um, but I really wasn't teaching much before then. I had already went back to what would be considered less than substantial work. But in two places, I had written that date down. But after filling this out and submitting it, they sent me more forms, like a work history form to fill out. And I really had no clue. This is a very stressful process. And I was like in tears over it, talking to my mom, trying to figure out how to fill it out. I'm like, I don't remember. Brain fog, hello. Years ago, I couldn't find records. So finally, I called the lady from Social Security, and she actually filled it out for me online. And she thought that they should go back and at least until 2017 with my disability, because that's when I really quit working enough to even pay into Social Security. That was the last records they had of me working. And I had been cutting back consistently since 2017. I had to hire somebody to run the studio for me, and I was cut every month. Half the year I didn't work, and then whenever I would try to return, I would have to cut off. So be careful with what you write down, because now I could try to go back and take my disability date back further. But now that I've been approved, if I do that, they can reconsider the whole thing. So I don't think it's necessarily going to be worth it, but it's 2 years of income, so I may talk to an attorney. So just be careful with the dates you put down. When they made it seem to me like that could be challenged later, and I figured it would be on when I had an attorney after I'd been denied once or twice. But since I got approved the first time, there was no attorney involved with deciding those dates. So anyways, moving forward, I think it also helps that the person handling your case speaks to you and gets to know you a little bit. And then they wanted more proof of my work history, so I had to send them tax returns, because I was a business owner and an independent contractor, so I wasn't actually a W-2 employee. So they needed income tax returns from 2017 and 2018 to show whether it was a substantial amount of work. So I had to send that in. And then at that point, I think it got sent to the medical review people. So I think I got a call from them, or I called when I first got my letter from my adjudicator and knew who was taking care of my case. And she's like, basically, we don't really see anything here that shows that you're disabled. And I was like, well, what do you mean? I've got all these diagnoses that I sent you. Didn't you get all my doctor's records? And she's like, yeah, but none of them say that you're disabled. And this is where I ran into the problem. None of my doctors wrote anything about any of my functional abilities anywhere in my medical records. So they would write a diagnosis, but then even my diagnosis weren't consistent from doctor to doctor, because now they have drop-down menus, and half of them don't know what POTS or dysautonomia is. Sometimes it said tachycardia, sometimes it said hypertension, when most of the time I was hypotensive. So nothing really matched up and was kind of inconsistent. So they were having a hard time trying to figure out what was going on with me. And I said, well, when I applied for my dad's disability, they sent forms that were like these functional forms, asking about his work history, asking about his daily activities. And she goes, oh, well, we can send you those forms. I'm like, well, will you please? And she said, sure. And she's like, is there anybody else that knows you that could fill it out? I'm like, who? And she's like, well, like, who knows you the best? I'm like, my husband, can he fill it out? She's like, yeah. So she sent me the functional report for an adult. So me and my husband both filled out the functional forms for the adult. My husband was pretty concise with his answers. I, however, was not. So I have a PDF editor, but so I went on and spaced everything out. I wrote as much detail as I could, and took up more than the spaces that they allowed for it, so that I could really show what my limitations were. And by this point, I had watched a video, and I'll post these in the comments after I give this to you guys. John Rodas and his wife, he's an advocate now. He's disabled with dysautonomia and Marfan syndrome. And he's active with the connective tissue disorders, rare disorders societies. They have both put presentations on the Dysautonomia International and the EDS Society YouTube channels. So I watched their video multiple times, and the one thing that they said is anywhere it asks you a question, what you can do, if you say that you can do something, combat that with, well, then I'm going to be down for this long after I do it, or anywhere that you can slip in a limitation, put in a limitation. So I did that on the functional report as much as I could. And then even things like where it says, do you use the following? And it asks for like, your like walkers, which I do use, but then it was others. So I even put in my compression garments, my shower chair, my IV pole, the IV cover I have to wear when I take a bath. So, like things that aren't on their checklist, but that I need for daily living so that they can see like I'm not just a normal functioning person. And then it also asks about your medications and the side effects you have. And like the muscle relaxants and the Valium that I'm on for my neurological disorder put, like drowsiness, altered mental function. So things like what is going to keep you from working. And then also just like things like flu-like symptoms, headaches, whatever your medication side effects are. But then they have a remarks section. So I had 2 pages of remarks, which were continuations of the questions that they had asked that I didn't have enough room to fill out. So, one of them was telling me your typical day. So I gave them 1 full page on my typical day. And then one was on bathing. And I put in there exactly how difficult it is and how infrequently I'm able to do that. So I went into it as much detail, like I said, as I could with that. So I think that was helpful to them. And then of course they had all of my medical records from my doctors, but also what I sent in when I sent in my functional report, or maybe it was even after that I sent in the functional report, that she was saying, we're really close, we just need a little more information. And I said, well, I saw some more specialists, I sent some more records in, and she's like, yeah, but there's just not anything there. So I sent in, let me try to find that, a personal statement for Social Security disability determination. And again, I went into a lot of detail. It's 2 pages. And I went over like, what dysautonomia is. I explained that. I went into what my immune deficiency is and explained that and how it affects my life and how it affects the tests, why some of my tests come back normal when I actually, my antibody tests, when I actually have a condition, or they're inconsistent. I explained how this stiff person syndrome I have, that there's a compassionate allowance for that. So I sent in the compassionate allowance and the diagnosis code for that. The problem was Mayo would not confirm my diagnosis of that because my levels were too low. But that's why I explained my immune deficiency and how it affects my antibody levels. So I took a little time, like kind of educating them, just like you have to do your doctors, because this, again, are going to be medical people that have never heard of your conditions. So I just put them, I started it off with, I have several rare chronic conditions that have no cures, most of which don't respond well to treatment and of themselves can lead to severe disability. Combined, they create a myriad of overlapping signs and symptoms that are difficult to distinguish between, and some of whose management options conflict. My doctors have not given me any hope of my condition improving and encourage my application for disability. We have tried all treatment options available to me, which keep me from requiring total care, but have not improved my symptoms enough to, for me to be able to dress, attend to personal hygiene, or cook my own simple meals on a daily basis. So, and then I just kind of concluded with that my days are consumed with self-care and ADLs. that used to take a couple of hours now take all day. And so that was my first personal statement. And then I also sent them a list of things that regular tasks that deplete. And I even went from like buy to try monthly, like ordering my supplements and skincare stuff monthly, putting away my medical supplies and bookkeeping, weekly, 1 to 2 times a week, and then daily. Things that I want to do, but I often skip. Things I don't do anymore. Things I can do with help. Things that can help or aggravate. Things that aggravate. And then things that improve the way I feel. So it was sort of my limitations. And what I really think helped too is I sent them information on POTS. So from Dysautonomia International, I sent what the POTS summary, and then I sent the 10 facts about POTS, and then I sent this flyer on POTS that has all of the symptoms listed, that are all the symptoms I had listed. And then I also sent in a article, I don't see it here, but I sent in the article from Dr. Grubbs, where it explains that people with POTS, it can be just as disabling as an equivalent to congestive heart failure and COPD. So there was a research and some research articles about POTS and dysautonomia and functional ability. And with sending in that information, I also highlighted the symptoms that I have that are disabling. And then like this one says there's currently no cure for POTS. And I like highlighted where it says like the percentage of people that are disabled from it. So I did send them information on stiff person syndrome and the compassionate allowance for that. And like I was saying, at that point when I was applying, they were convinced that's what I had. But then when I went to Mayo Clinic, they weren't convinced because my numbers weren't high enough and I wasn't sick enough yet. So they wanted me to come back in 6 months and see if I was worse. Which, yeah, now I may be going to Rochester to see a specialist there. But that was part of, I think, where my case didn't get decided right away because they kept getting conflicting information, because at the same time then Dr. Trevino had diagnosed me with Ehlers-Danlos syndrome. And so we didn't know if some of the muscular issues and weakness and pain I was having and spasms and all this neuromuscular stuff was Ehlers-Danlos or stiff person syndrome. My point was, it doesn't matter what it is, I'm having it, and it's not, neither one of them have good outcomes, and I'm not tolerating the physical therapy needed for either of them, and I'm requiring the medications for stiff person syndrome. So I also sent them all the information on Ehlers-Danlos syndrome that I could find, research articles that showed it causing the spasms and things I was having, or what I think, and now doctors confirm, dystonia as well. So I sent in, again, more research articles highlighting the symptoms that I have that would also be in my medical records, and how disabling they could be. So I constantly, like, whatever I sent, the information, diagnoses, I backed it up with medical research I found online. And how disabling it is, and also information on how not everyone, like, I don't present like the typical Ehlers-Danlos with hyper flexibility because I'm stiff as well. So I sent articles on that as well, and showing how you can have contractures with Ehlers-Danlos that prevents you from looking like the typical Ehlers-Danlos patient, which I also informed my doctors about, the ones that just brushed off the Ehlers-Danlos that has now been confirmed by a geneticist who understands the modified criteria now, and I have, um, you know, all the other symptoms of it, and we're working me up to just make sure it's not a more serious form, which we don't think it is, but anyways, sidetrack there. But I'm just saying, whether your doctors have confirmed it or not, if they're treating you for it, if they're testing you for it, you have information on it, you have symptoms of it, send it in, write it down. If it's in your records anywhere, whether they're still questioning it, it's confirmed, send it in. It just shows how complicated your case are. That your doctors can't even, it's not your fault that you haven't been able to get doctors that are educated enough to give you a diagnosis. It still doesn't mean that you're not disabled. So then they were like, okay, now we need work history information on you because, okay, you're saying you're disabled, but that doesn't mean you can't work. So then I had to fill out my work history, which again, it was long, and I kind of think I may have screwed myself up. I could have gotten my disability dated back further here, and this is where I actually wanted an attorney to help me, but no, an attorney wouldn't take me until I had been denied. Where I made the mistake is I still own the yoga studio. So I put that I'm the owner, the director, since 2017 to the present date. And then in the description of that, I put that I was working 4 to 7 hour days, 7 days a week or something like that, something crazy like that. Well, that was when I first bought the studio. In the first few months, when I quit working as a CRNA, thinking being a business owner would be easier. And there was nowhere to explain in here that within a couple of months of doing that, I was no longer able to do it. So it was a little misleading there when I went back and looked at those records. So be careful with what you put, because they aren't looking for a reason to approve you. They're looking for a reason to deny you. So be vague or go with worst case scenario. How I should have answered it is how much work I'm doing as that owner director now, which is basically nothing. I have hired somebody to do everything. I'm just answering emails that my manager can't do, and I'm signing the paychecks, or now I'm transferring the money online. So actually, now that I've been approved for disability, I'm not constantly going to doctors and constantly spending all day trying to fill out these forms. I am feeling better, so I am a little bit more involved, but still I did 2 days to get a promotion going, and then I was down for 2 days. So there, it's a roller coaster ride, because you feel guilty that you're young and applying for disability when I've had a strong work ethic my whole life. And even now I'm like, oh, what can I do? And then I'm not even able to, take a shower because I tried to do a couple hours of work. So don't let yourself get caught up in that I don't deserve disability, because there's no way I could work right now. And if I worked, I'd be back in bedridden again. So I'm making slow progress where, I'm able to function a little bit better, which means I can walk around my house most days now without a walker. So keep your head up and keep pushing through. So when I sent the work history in, they still didn't understand what I did for a living. Who knows even what a CRNA is? So I tried to be as descriptive as I could, but it's kind of difficult. So I actually sent in protocols because I wanted them to know how much responsibility my jobs that I had required as well. Because just the medications alone that I'm on, I could not work as a nurse, and really should not work as a yoga instructor either, because I'm under the influence. But I sent in like my nursing protocols and job descriptions for the work that I had, showing how much responsibility it was. At some point later, I ended up writing another personal statement explaining how physical my jobs were. I'd never sent it in. I sent it to my doctor. So at this point, with everything I had sent in, they had pushed me through to be approved. They thought that I met, you know, my adjudicator kind of told me without telling me, but she thought I should be approved, that they recommended approval. Well, I didn't hear anything for a while. So I called, so they were holding up my putting through my determinations because they were waiting for more information. So I did go see Dr. Grubbs in Toledo. He did confirm the POTS. He did also witness one of my muscular episodes and said that he thought it looked like dystonia. He's, you know, his patients that have dystonia. So he actually prescribed me a new muscle relaxant baclofen, which is for dystonia and also stiff person syndrome. So I sent them the summary from him, also stating that he diagnosed me with dystonia. And I explained that dystonia is a movement disorder seen in Parkinsonian syndrome, multiple sclerosis, I can't say it, and other autoimmune neurological disorders. And it can be idiopathic. And I have included a scientific article on dystonia and Ehlers-Danlos syndrome. And I highlighted the clinical manifestations I experienced. So again, I sent them more articles showing how these things manifest in people with my conditions. And then I also sent a letter from my immunologist regarding the common misunderstanding among physicians regarding antibody testing with specific immune deficiency, which I have, showing how it messes up these antibody tests that, you know, they go on to confirm diagnoses, when it should be based on a clinic. Most of the conditions I have are supposed to be clinical based anyways. The tests are just more evidence. So anyways, I wrote another little update letter to them just to let them know what I'm thinking, what my doctors told me, because it's not always, my doctors aren't putting in really good notes, aren't mentioning what my functional limitations are. So I sent the doctor's note, the article, and an update from my immunologist. So at that point, I was done seeing specialists for a while. I had tried physical therapy because this was all pre-COVID. I couldn't even get through the evaluation twice at physical therapy because I went into such severe muscle spasms, but they didn't even put that in my notes from the physical therapy when I requested my physical therapy notes. So once again, my doctors weren't really giving the information that disability needs to make a decision. So I got another call from them saying that now, since I saw a cardiologist, they needed me to fill out a supplemental cardiac questionnaire. So I sent that in, and again, I explained that Dr. Grubbs prescribed a medication, Corlinor, which is prescribed for patients with heart failure. Like, again, emphasizing this is something that affects people like heart failure. And I went into great detail, over answering these questions again, but I didn't type it out this time. I wrote and went off in the edges, but it actually asked some of the questions that the first functional assessment asked, but now my condition had worsened. So it actually showed that I was like getting progressively worse since the first time I had filled these out back in October, and now it was March. So I went into great detail again, explaining my functional limitations, even in the cardiac questionnaire. So every time I filled out a new form, I went back and rewatched those videos on the recommendations on how to apply for disability, and tried to add in a limitation any place I could, or what I can do, how it affects me, how long I have to rest afterwards, or how doing like simple tasks that other people do, I can do once a week if I'm lucky. I can't do them daily. Between after sending in the cardiac supplementation, I got, I called to check on an update, what's going on with my case. And when I called the state, they were like, well, it says that you were approved here. And I'm like, what? And he's like, yeah, it said that they recommended that you were approval, and I don't know why you haven't received payment yet. But it looks like it got sent back to the local office for processing. So I called my adjudicator, and I asked her what was going on. And she said, yes, it did get approved, but when they send it back to the local office for processing, they often like randomly choose a case to get sent to the regional level for a second glance. So somebody else to try to find a reason to deny you. And this doctor was saying that there were inconsistencies in my records and that they needed more information. And then I said that I was getting, that I had some more upcoming doctor's appointments, and that I was getting, just to kind of buy me more time, which was true. I was going to see my doctors, and also that that they were going to write statements for me that I would submit. So I was in communication with my adjudicator regularly, saying, that more information is coming, or what do you need, and this is when I actually, I think Cheryl recommended to me filling out a residual functional capacity form. So at first I went online and downloaded one, and I requested Dr. Vickers to fill one out, and he didn't want to fill it out. He was like, I'm not, he didn't want Social Security to have to tell him what information to put in his chart. I think the way I stated it, I pissed him off. But basically, I was telling him that you're not putting enough information in my notes, because none of my doctors were still putting my functional limitations in my notes. So that's why I asked him to fill out a functional form. And he said, when Social Security sends it to me, I'll fill it out. So I got a little frustrated with him. And I actually reached out to John Rodas, who his wife is the disability attorney, and who his videos I'll put in the comments. And I asked him if there was a functional capacity form that they recommend. I showed him the one that I had filled out, and I asked him what else I could do at this point. That my medical records, my doctors don't have functional information in there, that they're inconsistent, there's errors in them, but that I just didn't have the energy and the time to go back and even get them corrected, and that I was having trouble getting some of my doctors to help me out. So he sent me a residual functional capacity form that his wife uses, an attorney, in her cases. And I actually filled it out myself and sent that to my doctors, so they would know where I am right now with my functional limitations, and so that they would know all the diagnosis I had, even from my other treating physicians, and all the symptoms I have. They don't necessarily write down because it's not their specialty. So I filled it out completely, every little last detail, and I wrote down my own prognosis that I had been told by every doctor at that point. They don't have a time in a 15-minute or even a half an hour appointment for you to go over all of your functional limitations. You're there for a focused appointment on, like, what are we doing how are we moving forward from here? Because some of these things, like, your doctors aren't having you lift weights in their office to find out how much weight you can carry. So it's pretty much, they're going by what you tell them anyway. So I filled everything out for them and sent it to them with the blank forms for them to fill out. And the digital forms in case they wanted to, like, just copy and paste it or whatever. So I think that was helpful, and that was helpful in me getting it back in a timely manner. And then my my cardiac nurse practitioner was really awesome. She did a great job filling it out because she went above and beyond and put even more in than I had given that she witnessed and knew about my case, that I think helped a lot. Family physician filled it out. And I sent one to Dr. Trevino as well, and they were working on filling it out. I didn't send it to Vickers, even though he said he would do anything to help me, but I'm like, well, I was a little upset with him, and he had said if it came from Social Security, so I wasn't sure if he would fill it out or not. My therapist wrote a letter, and at first she wrote that she just thought I should be approved for disability, and I went back and asked her to rewrite it because they don't want your doctors to say that you are disabled. They want your doctors to give the clinical information so that they can decide based on their criteria whether you're disabled or not. So I was, cautious if my doctors would say they're in support of my applying for disability, which is what my therapist wrote. And she saw how long she'd been seeing me, and how frequently she'd been seeing me, what diagnosis I have, and how that affects my chronic and debilitating medical conditions, and how the chronic and debilitating medical conditions have added to my mental stress, I guess you would say, or mental health. She even put in there that I report to her that it takes most of the morning to do the self-care I need to get ready to leave the house for my appointments, which are usually between 11 and 1 p.m. That I get to her office exhausted, and upon returning home after the appointments, I need to rest the remainder of the day. That I go into her office with the assistance of a walker. I need to elevate my feet while I'm there. I have difficulty sitting down and standing up from the couch. I appear physically uncomfortable for the entire hour that I'm there. And then she also wrote down that I report that I have brain fog, that I have difficulty communicating effectively with my doctors and specialists, and that I feel that I'm actually unable to effectively communicate my functional status with my doctors, and that causes me a great deal of stress, and that I frequently forget to ask questions, even when I have them written down. So that I think was also helpful and true, and it's something me and her talk about and try to work through. And she's also put in there that in addition, I frequently have incapacitating episodes during my doctor's appointments that become the focus of my appointment. So that, I usually don't get a full exam. They don't have time to fully assess me. So my assessments are even incomplete. And so they're really not taking the time to write down how it affects my function or my ability to work. And then she just wrote basically that I have worked hard to establish strategies and skills to manage my disabilities. But despite this, I frequently have days where I don't feel well enough to leave the house and struggle to perform my activities of daily living. One of the things that John recommends too is don't shy away from the mental disorders, because they're not going to say it's all in your head. It just means that you are having maybe depression and anxiety associated with these physical diseases, or sometimes it's actually the first clinical signs and or a symptom of the physical conditions that you have. So don't be afraid to put that in there. And I also put in, emphasize my insomnia, everything that I have going on. So I think, having every clinician you can write a report helps. My acupuncturist wrote a statement, basically how long she'd been treating me and how often. And because I had episodes during 2 of my appointments with her, and one of them was so severe that she had to help me sit up. She could feel the quivering and the spasming in my back, even when she couldn't see it. That she had to actually get my Valium for me and administer it to me because I couldn't get it or take it myself. that I wasn't even able to use my walker to walk. I had to sit, and she had to push me into another room where I could, and she had to help me get into a chair to get comfortable. How long the episode lasted, and then she had to get me water and then food, and she stayed with me until she could observe that I could safely eat and drink and breathe on my own. So I think that was helpful. And then I also had my family doctor fill out the physical residual functional capacity. Now, he actually just took everything I wrote and he thanked me for filling it out so completely. And he just basically signed his name to it, which he said, he was comfortable doing because it was all true and he agreed with all of it. So I sent those in, and I was waiting, and I told them that more information was coming, that I had requested my immunologist to write a statement, and I was still waiting for forms from Dr. Trevino. So I was actually surprised when I saw a deposit in my bank account and called disability, or my adjudicator, and she said, yeah, we thought it was going to get approved, but I didn't want to contact you until I knew it was approved. So I still didn't believe it. So I went on my disability, I signed in online on disability, and it said I was approved. I still hadn't received a letter or anything in the mail. So I was like, oh my gosh, I got approved. And that was without even getting all of the statements from all of my doctors. So I think just and without getting one from my neurologist. So those, I always say it wrong, the physical residual functional capacity questionnaires, I believe, are really, and the personal statements from my therapist and acupuncturist that were detailed and explaining, and so that they actually witnessed the functional limitations, were very helpful. So if your doctors aren't keeping good records like mine aren't, or if they're inconsistent like mine were, it still doesn't matter if you can provide proof for yourself by your own statements, and then if you can get somebody to back those up. So I hope that helps. I did end up getting a letter from Dr. Rosenbach after the fact. And I'm like, why didn't you give this to me like years ago? Because he actually kept the best records out of any of my doctors, him and my primary care physician. But disability wasn't looking through his notes when I was complaining about being disabled from more the cardio and neurological standpoint. But that is something that I also added into my what I sent to my physicians with the residual functional capacity form, was how my immunological issues and immune deficiency have been affecting me since 2013, and how restrictive not only my work had become, but how my personal life had become, that I can't go out in groups, that I can't go to the movies, that I don't go to parties anymore, or that I very limited on where I can go out to eat, what I can eat, I can't go to the mall because of perfumes, so I also explained that. And then I also found that you can be approved for their disability based on immune deficiency alone, and that I met all of those criteria. So I printed out and highlighted what I thought I met the criteria for without having HIV, on immune deficiency, and I sent that in. I did that also. I sent in, and that's one thing to look up. There is a blue book for disability that they go by, that they have allowed conditions. And you may not have any of those diagnoses, but you may have symptoms that are very similar, that meet where you can say it's equivalent to this diagnosis. So that is one thing I did too. I looked up like the Parkinson type of things for the dystonia. For the immune deficiency, I put that in there. And even the cardiac, I looked up and put like how my condition kind of matched heart failure and stuff like that. So you can look up those um, allowable conditions or the blue book conditions and match those up with your diagnosis and your symptoms, and that might help as well. So I don't know what of all of those things I did worked, but it took me months, and I actually just kept staying in touch with them, letting them know that I was sending in more information so that they didn't process it without full information. Um, and then they still ended up processing it without full information, and I got approved. So overload them with information. Don't be afraid to send too much. But again, I would use caution, I guess, in saying like definitive dates on when you became disabled, or um, because like I said, I kind of messed myself up there a little bit. And also at first, part of what they were why they were saying I could work is it somewhere in one of my limitations, I said that I could occasionally lift more than 10 pounds and frequently lift less than 10 pounds. And somewhere in there, they got the idea that I could sit for more than 2 hours straight, which I couldn't find that I had submitted that anywhere. But somehow that weight restriction thing, they thought that there was some job I could do. So be careful about that. Because I did not understand until I got their forms for my doctors what their definition of frequently, occasionally, and rarely mean. So that is important too. And I'll upload the form that I have on the physical residual functional capacity. And I believe in there is where it explained um, what the difference between rarely, occasionally, frequently, and consistently mean. Because before I knew that, I was answering questions using those words, and that didn't really match their definition of that. So I think that's why I originally got, they asked for more information, or I may have even been approved sooner with a lot less work. So it does take a lot of work. I kept explaining to my adjudicator that I couldn't meet the deadlines and getting the forms back to her in time because it took me weeks and weeks to get every little bit of information to them. So just keep being consistent. If you guys have any questions, reach out to me. And good luck. Check out the videos I posted and just try to follow that information as much as you can. I actually, like I said, reached out to John myself, emailed him. He emailed me back right away. He sent me the forms, and he also sent me his quality of life statement. That was the key thing too. I was having trouble with that. I was wanting to write a book. His was 1 page. Mine didn't make it in 1 page, but I made it into 2 pages. And I'm happy to share that with you guys as well. So just email me. I'd rather not post that on Facebook. So I'd be happy to email it to you if you'd like that information. One other thing I forgot to tell you guys is make sure that you answer based on your worst day. They don't understand conditions that are inconsistent, that you can have good days and bad days. And for me, that was what made it so hard for me to fill out the forms. Luckily, the last forms that I filled out to send in, when I was filling out the forms to send to my doctors to fill out the residual functional capacity forms, I was having like one of my worst weeks. So it was actually easy for me to answer and to create my quality of life statement. But the truth is that can happen any day, and it can happen for days on end, and that's why I can't work. So keep that in mind. Answer based on your worst days, not your best, and not even your average, because they're going to think that that's what you can do every day. sitting, standing, lifting, basically the stuff they asked you in the functional report, but I updated it. And then meal preparation and eating. You know, I went into as much detail as saying my husband has to fill my teapot and water bottles and leave them on the counter for me to use throughout the day because I can't fill up my own water bottles. I have to tip. I can't even lift the teapot. I have to hold it on the edge and tip it to fill my water bottles. That I can't use the microwave or the stove because I can't reach up or down. Um, can't reach to the back of the refrigerator or down into the freezer. So can't squat or kneel over to get into the bottom freezer. So I was very specific in what I could and couldn't do. I talked about hygiene and how infrequently I'm able to bathe or wash my hair, dressing, that I have to wear the compression garments and sometimes I need help taking them off and putting them on. Physical activity, how far I can walk without stopping, how long I have to stop to rest. Basically all the questions that they had asked before, but I updated them. And then I even put in here advice on seeking medical care, because that's one of the things too. I don't run to the emergency room. I'm an advanced practice nurse and we're our own worst enemies. I don't seek medical care when I should because I know how to treat it at home. For the longest time before I got IV therapies, I would go to work and they would throw an IV in me, or when I was working, I would get one after work. And I've even started them on myself and, you know, with stuff I brought home from work. So I put in there that Dr. Vickers told me not to go to the ER unless I have a traumatic injury or I need life-saving measures. So I put that or that he said I am beyond their level of knowledge of any physicians locally and including his. And then I put, I treat my systolic blood pressure less than 80 or heart rate over 160 at home with IV fluids and Midodrine, because by then I was already approved and getting at home IV therapy. I also put that now Dr. Vickers and Dr. Rosenbach said I was not allowed to go to any appointments, be out in public, or travel during the pandemic to avoid catching COVID at all costs. So showing again that not just my dysautonomia and my neuromuscular issues limit me, but my immune deficiency does too. That even, you know, now with the pandemic, I'm even more isolated. So thank you all. Be well.